Good evening, welcome to the September 5th, 2017 Dayton City Council meeting. Tiffany, roll call.
Mayor Borowski.
Here.
Member Vulture.
Here.
Member Burns.
Here.
Member Neary.
Here.
Member Baker. Member Haas. Member Lynn.
Here.
Member City Administrator Giffen.
Here.
City Attorney Ed.
Here.
All rise for prayer and pledge of allegiance. I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're going to change this around a little bit, Michael.
I'd like to introduce Michelle Kreutzkamp. She's the nurse manager of the emergency department at St. Elizabeth's. We've got a whole crew from St. E's here, so I'll turn it over to them for a presentation.
Thank you. Thank you for having us tonight. Just want to give you a little bit of an overview on where we are organizationally with the opiate epidemic. I know many of you already know it's facing all of our communities. And then we have some additional speakers for you as well. And we have a slide presentation, but we'll send it out to you as well. We'll make sure you get it. So I think it's important to know that, we are the healthcare system in our community. Our friends and neighbors depend on us every day. So we see nearly 5,000 breast screening patients a year. We see 1,300,000 visits to our physician offices. We have 56,000 admissions a year. We see over 562 patients in our hospitals on an outpatient basis. We have end-of-life hospice care. We've cared for over 1,400 individuals. We have more than 31,000 surgeries this year alone. We birth almost over 4,000 babies in our healthcare system a year. We have heart screenings where we've completed 1,900. We have over 2 million patient encounters in our organization just in 1 year. And over 207,000 emergency room visits. So we're in an important role in the community. We are Health Grades named us 5% in cardiac care. We're the first one to offer us the smallest pacemaker. We also offer devolving stent, one of the first to perform outpatient knee surgery. St. Elizabeth physicians have the highest ranking in their region. We offer our C-Tech Simulation Center, and I don't know if anybody's had an opportunity to go out there. It's an amazing opportunity for us and the community, Simulation Center. And then we continued our partnership with the Mayo Clinic. But when it comes to the stand against heroin, we made some important changes in care to our community. One of the things that we wanted to follow is I've been a member of the Northern Kentucky Heroin Impact Response Team since it started. And we really took it not only outside in our community, but we actually brought that internally into our organization to figure out what is our fit and where we need to be in this epidemic. So we look at prevention. That is one of the things we look at. We've done a lot of physician education on opiate prescribing. We've also done a lot of education in the schools. I've actually spoke to the Dayton high schools and done annual education to a lot of your teachers as well. It's a great opportunity. And we work closely with our partners with the Drug Free Clubs of America. As far as the treatment belt goes, we extend additional clinics. We have a St. Elizabeth physician group that has a clinic that we were able to care for patients who are struggling with addiction, and we serve more than 200 patients in that office. More resources with our neonatal absence syndrome. So this has to do with our babies. We actually have care coordinators that work with our moms who are pregnant with addiction and offering resources and following them throughout their pregnancy. And not only just through the pregnancy, but then after pregnancy, which is very important. We developed a hotline with a partnership with our county fiscal courts. We've seen great success in that helpline. We can call that. We actually use it quite a bit out of our emergency rooms too to get patients in for assessments and treatment. We seek local and regional and federal funding to expand our programs not only to our moms, but also the care in our emergency rooms. And we began construction on the Sun of Behavioral Health. So if you've seen that on the 275-75 loop, that big building is massive. It's going to be a great benefit to us in the community. And then when you talk about protection, we continue to distribute Narcan rescue kits, not only to our law enforcement agencies, our EMS agencies, but also to our patients. So if you come in as an opiate overdose in our emergency rooms, you will be able to go home with a Narcan rescue kit. We were one of the first ones. We actually got state funding from this 3 years ago. We got chosen with U of L to be one of the distribution centers in our emergency rooms because of our overdose numbers. And I will tell you, I'm proud to say, out of all of the areas that we're able to get the Narcan for overdose patients in our emergency rooms, St. Elizabeth is the one that has it sustainable and developed a program, and we've used it for the last 3 years. So they continued it for us again this year, so we're really grateful for that. We also work with the syringe access programs in our community. So what's substance use disorder? It refers to the overuse or dependency on drug, leading to the effects for individuals for physical and mental health. It's characterized primarily by psychological symptoms of like withdrawal. So if you have withdrawal, and when being in that one got real loud in there, the hair went off, sorry. And then you failure to meet your obligations with work, school, interpersonal conflicts, legal problems, then you have a substance use disorder. And it affects a lot, and you guys have seen this in our community just about everywhere. But once you start having the withdrawal symptoms, that is when we look at it as addiction, is when you start feeling sick or having withdrawal symptoms from your drug use. You all know, and we've seen the overdose numbers climb really since 2012. And I'm not blaming House Bill 1, we needed it, trust me. We needed to cut down on the prescriptions. We needed to look at things a little differently, but you all know what came right behind that was the heroin. And you've seen the rising numbers since then. So, 2011, heroin's not a new drug. We've seen it used, and I've been in the emergency room for 22 years. So we had 252 known heroin overdoses in 2011 to 1,584 in 2016. Year to date in 16, we've already seen 1,379 through July. I was telling one of your councilmen prior to the meeting tonight, July of 16 and July of 17 were kind of flat. August is looking, not as bad as we've seen first quarter of this year, the first 4 or 5 months this year. But you all know when the carfentanil and the fentanyl came in our community last fall, we've really seen an uptick since then over the last 6 months. And it hasn't really slowed down. I consider 1 month of being flat kind of stabilized a little bit. But, I thought we were in good shape at the beginning of last year, and then, other drugs and synthetics get introduced to our community, and we're back all over again. As far as our hepatitis C rates, something that Northern Kentucky should be proud of, and that is that we have the highest rates, 19 times higher, greater than the average rate in the United States for hepatitis C. And one of the counties that is in that vulnerable area is Campbell and Kenton. So we're right here at the tip. And I think Dr. Savani is going to talk a little bit more about that hepatitis C infection in a little bit later. But we're vulnerable, and we're at the tip of the iceberg there. So the average cost to treat a patient for hepatitis C is about $80,000, and then a liver transplant is almost $600,000. So we know that there's a cost to this disease to our community as well. The lifetime to treat a patient for a hepatitis, for HIV, is anywhere from $600,000 to $800,000 for HIV. Per episode for an infection of the heart valve, which is called endocarditis, is approximately about $120,000. It's estimated that across the United States that local governments spend about 9% of their budgets on issues related to substance use disorder. And I know you guys feel that impact. In Kentucky, we're spending almost $6 billion a year. In Northern Kentucky, 800 current cases of hepatitis C were treated. It would increase the cost to $54 million in our community, which is devastating. So even a problem with heroin uses hepatitis C, you can see that it's costing our taxpayers millions of dollars. So I have an overview slide, but I just kind of wanted to let you know. So one of the things that we looked at from the Northern Kentucky Heroin Impact Response Team and organizationally is obviously reducing supply. They want to look at establishing a regional infrastructure, which I think we've done a really good job of that, working with our community partners. We're advocating for change. A lot of it is we've testified with many House bills, and we've also spoke not only locally and regionally, but actually nationally about what's happening in our region. We're not the only ones, but I will tell you, I'm proud of where we are. I just was down at UK talking about some things that we're doing internally at the University of Kentucky that we're doing at St. Elizabeth, and I'm proud to say that we really are ahead of a lot. And I just got another email from somebody that I spoke at a national conference less than a year ago, emailed me and said, hey, I'm ready to talk, we need your help. What are you guys doing? So it's pretty exciting that I feel like we're definitely moving in the right direction, even though we have a lot of work to do ahead of us. And then I talked about the things we've done for prevention, treatment, and support. I mean, that's one of the biggest things we need from our community is to continue to, educate and support efforts that are helping with this epidemic. And then protect from harm. And that's really where the hepatitis C and the spread of disease is so important. So a little bit about our St. Elizabeth Physician Group. I think it's important to know that we do have an addiction medicine and recovery center. Current state, they're growing leaps and bounds. We're moving to a new facility. They're going to add additional doctors and moonlighters and 10 drug counselors. So we continue to involve with an intensive outpatient program, case managers, crisis intervention rooms. So as we grow and we understand what's happening in our community, we are also growing our service lines as well to meet that demand and need. And that goes along with our mothers and babies. And then a little bit about Sun. So Sun Behavioral Partner is a partnership with St. Elizabeth. It's a hospital currently under construction. It anticipates opening late February, early March of 2018. It's going to provide us 197 total mental health beds. With the mental health, there also will be chemical dependency treatment beds. Psychiatric emergency services. And Sun is a partnership, again, that began because we really needed to look at our community for better resources for our behavioral health in our community. And a lot of our patients who have the addiction disease, a lot of them have a dual diagnosis. So we need to look at the mental health aspect of it along with the addiction part of it. And this is where this opportunity with this Sun is really going to help us. So I'll let, is Amanda on next? Right, okay. So I'll let Amanda go, and then Dr. Samani, and then at the end, we'll be happy to take questions at any point, okay? Thank you.
I'm going to stand over here if that's okay. I didn't even notice that I brought slides, and I can email that to you guys.
While we're waiting for that to come up, one thing you didn't mention is St. Elizabeth community involvement. You've been very involved with supporting our athletics here in Northern Kentucky, especially in Dayton. We have new scoreboards in our gym thanks to St. And I know you provide personnel at all of the athletic events too. It's much appreciated.
Thank you. It's a great relationship. So
Like Michelle said, my name is Amanda Peters, and I coordinate the Heroin Impact Response Task Force. I started with the task force in April, but I was with Frank Center and into the youth beforehand, so I was doing this work on another angle. I just didn't realize I was going to get this immersed in it, but it's been quite an education, and as Michelle has said, is that we really are on the forefront here in Northern Kentucky. We get calls from all over the state, and we're starting to get calls outside of the state asking, what are we doing? We hear it's working. We just hear this buzz about Northern Kentucky. You're on the forefront. Come and talk to us. And that's what, like Michelle says, we've been doing these different things. So what the HERT is, so it's a task force, and it's made up of a bunch of partners. And St. Elizabeth, of course, is a huge partner in that, as well as the Northern Kentucky Health Department and Three Rivers Health Department. Because we do 8 counties. We do the 3 northern Kentucky counties, and then we go down to Pendleton, Grant, Owen, and Gallatin, and Carroll County as well. Our mission is to ensure that people in Northern Kentucky will have access to life-saving and life-restoring resources for addiction that would reduce the impact in our communities. Michelle talked a little bit about the strategies that we use, and we really kind of put them under 6 pillars, and that is prevention, treatment, harm reduction, supply reduction, advocacy, and governance. And we utilize those pillars for our different strategies and how we're going to implement them. And some of the just partners that we have, we partner with local schools, we partner with the judicial system, we partner with the Department of Corrections, treatment providers, our medical professionals. We partner with foster care and different children's services. We're partnering with nonprofits and social service organizations. So we're really bringing everyone to the table to look at this issue from all angles, because we know it's costing taxpayers. We know it's costing our schools. We know it's costing our families. So we're trying to bring everyone together for the best solutions. So we're taking a regional approach, and we do our 8 counties, but we're also reaching across the river to Cincinnati. We know that the drugs don't stop at the river. They come right over, and they travel on down the highways. And we're also working with our partners in Southwest Indiana. And we know that substance abuse isn't the only barrier, and that's another reason that we're trying to pull everyone together to make sure that we're looking at these different issues. And like Michelle said, mental illness is one of those big issues that is the underlying cause of this. So we take a multidisciplined, multi-generational approach. We know that in families, it's just not one generation. It usually affects many folks. And we are pulling in all those disciplines. So we partner with law enforcement and first responders, and we're looking to decrease incarceration rates, and we're looking to decrease recidivism rates. So we want to stop people before they get to the jails, because that's another drain on taxpayers, but also look at how we're going to work with our different partners for relapse and recidivism, because we want to tackle this problem from every angle. So we also, in my group, we bring together people to maximize those resources, because even if you're in a nonprofit, you still have to make the money, you still have to pay your staff. It's still overwhelming, almost every system that we have. And we're looking for strategic partnerships and innovative collaborations. And Michelle has talked to a few about this today. So we're also looking to streamline delivery systems and look at service gaps and barriers that we know that people with substance abuse disorders have. But we're also looking at the barriers in the service delivery from other angles, as well as, how does this affect our government? How does this affect people that this may not hit directly? It's still hitting them indirectly. So we're looking at that. And we want to rely on data to make the best evidence-based research, best practices approach. So some of the things that we do, one of the 3 strategies that we really hit on is the prevention, treatment, and support. So for prevention, we're using our drug-free communities, we're using our clubs, we're looking at community education from many different partners, from the hospital systems down to other treatment providers, and our advocacy groups are going out to the community to make sure we're reaching the folks that may not hear in some of the traditional ways. We're also looking to provide resources to schools to promote social and emotional health, and to make sure people are getting the coping skills that we need. Kentucky kids that we know have high ACE scores, and the ACE scores is an adverse childhood experience, and we know that our kids are dealing with many things on many levels. And so, if we can get to them early enough to get them those coping skills, this may, it's hard to predict what we stop. That's always hard to gauge there, but we're looking to curb some of that. Student drug testing is another technique, which I think Dayton already does, which is you are on the forefront of that issue, and we use you as a model as we're talking to other schools and saying it's working for Dayton, the students are supporting it, and we're using you as a model to give a little friendly peer pressure for other places to do that as well. And we want to make sure that there's resources available for those at risk for relapse. Treatment is another way that we know we need to hit this hard, and we're looking at doing crisis intervention in emergency rooms. We look at syringe access programs, medication-assisted treatment, which would be methadone or Suboxone or Vivitrol, different evidence-based ways that has helped people in addiction. We want to look at peer restoration programs. We have 2 in the Boone County and Kenton County area. And then we also have the Alexandria ACTS program, which is a version of pre-arrest, but it's a little different. They utilize community volunteers that do crisis intervention when something happens, and they do a little broader scope than just addiction. Some folks are housebound or other issues they know in, that's hitting their police department hard. They have a social worker going out instead, and that's saving them dollars that way. And then we have addiction treatment within 2 of our county detention centers. We have men and women in Kenton County, and we have a women's program in Campbell County. And what's really neat about that Campbell County program is that the ladies that come into, they're already incarcerated through the county system, and they have to have at least a 6-month sentence. And then once they have that sentence, they sign on for an additional 2 years once they're released. And then that's 2 years of case management, follow-up, and wraparound services to really set them on a path for self-sufficiency and keep them in recovery. We're also looking to increase capacity for transitional living programs. We want to look at the moms and babies. We have a lot of babies living in this crisis. Look for those pregnant moms to serve them that way. And we also want to increase peer recovery specialists and also look at family transitional living. And then one of the things I'm trying to do right now is develop a team to do street outreach. And this would be first aimed at youth, that we're going out to the street and make sure we're hitting those youth, but also to get the other older folks as well, because this is not an epidemic that's just hitting one demographic. It's hitting everyone at every angle. And that's just some of the ways that we're looking for different ways that we can get treatment and avenues. So any place that they have contact with a medical professional, whether it be the health department or the emergency room or their family doctor, that should be also an avenue for treatment. And then we want to support. We either want to support those in recovery, but different wraparound services. We want to look to support different our first responders and the people on the ground and trenches doing this work. But we also need to support our law enforcement to get the drugs off the street, and as well as law enforcement, our medical professionals. So we're looking at a couple different ways of how we get drugs actually out of the street or even out of the medicine cabinet. Because a lot of times, some of this starts at home. We know that 80% of folks that have a heroin issue, it started with prescription pain pills. And that's a pretty high number. People will say the first time they got their fix was through their doctor. And we trust doctors, which we should, of course. But that's just something that we're looking at in our strategy. So we're partnering with our regional law enforcement agencies. We're also looking across the river. Northern Kentucky has been designated as a HIDA area, which is a high-intensity drug area designation, and the drug trafficking area. And what that really means, it's a federal designation that's bringing dollars down. And I just talked to the Northern Kentucky Drug Strike Force today, and one of the things that we're seeing is there's an influx of methamphetamines coming in, which can be used almost the same ways as heroin, and they got a kilo of that just last week. So that's already coming, and we're looking at different ways we can combat what we're dealing with now, along with what's coming down the pike in the scope of addiction. We're also looking to educate medical professionals, as Michelle was mentioned, and then prescription drug monitoring programs, and Kentucky specifically has the CASPER system, and that's going to help eliminate some of that. And then we passed legislation for a 3-day rule of when you're getting that first opioid medication, and there must be follow-ups. And even folks that are on these pain medications, because some people need pain medication, is they can't just call in their prescriptions. We're seeing that they have to come in month after month. They have to have that touch point with their doctor. And then we had the drug take-back initiatives, and I know a lot of police departments keep boxes inside of their agencies, but then a couple times a year we do outreach and set up different places so folks can come and bring those. If you get your wisdom teeth and you get a script for 50 Vicodin or Percocet, you may not need all that. You may not want to leave it at home, but this is a place that you can bring it safely without putting it into our water streams and different things. So some of the accomplishments that we've done, we have the addiction helpline, and I brought some cards I'll leave down here for you guys to have and then pass out. I know the Drug Free Coalition in Hill County is going to be working with Dayton specifically to do blitzes throughout the community. They're going to do it at school start, so I need to follow up to figure out where we're at, because we're going to help with that to make sure that these door hangers are going on every single door. And it's really a lifeline for folks to get resources. And then we have the designation of the HIDA, which is bringing us federal dollars, the federal attention. We have the Grant and Pendleton County Syringe Access Exchange programs. Our rural counties are really leading this charge. They're almost at a point where they don't have any more options because they're out of money. So they're looking at every way that they can combat this and still saving the dollar. We have our different quick response teams, and then we're looking at expanding community education and engagement. We're looking at doing this strategically to really go out and do some focus groups and entertainment, education. Not entertainment. That'd be a different scope. But looking at, instead of just town hall meetings, a way that we can really engage with folks, because I don't know that the task force in the past has always engaged the families and the person with the substance abuse disorder directly, and we're going to target that to make sure we're hearing what those barriers are and some of the reasons why they haven't stayed in recovery or haven't sought out recovery. We also are looking to increase our methadone and medication-assisted treatment programs. We're increasing additional detox bed and treatment options. One of the things that we have is we have 317 treatment beds in Northern Kentucky and 43 detox beds. And the next stat, I confirmed that first stat. The next one is that I was told at any given time we have 5,000 to 8,000 substance abuse users in Northern Kentucky. And we only have 317 treatment beds, which some folks can go straight into medical assisted treatment and not necessarily need detox, but there's still a huge gap there. We're not going to hit anywhere near that 5,000 or 8,000, but we're getting ready to almost double 100%. We're looking to add about 286 beds by this time next year between St. Elizabeth, Transitions, and Brighton Recovery Center if their zoning issues go through. And then we have a nationally recognized jail abuse treatment programs, which I've mentioned. That's featured in the New York Times, in different places that folks are really looking at, how is this working? We're looking at addiction treatment differently. And then, of course, the new legislation with the prescription opiates and Casey's Law. There was a new amendment that just passed that if you do utilize Casey's Law, which is an act for involuntary treatment, a family member or a loved one can file this on behalf of them, and then their court-ordered treatment is, there's an amendment there that, if the person does have insurance or Medicaid, they can utilize that. In the past, whoever was petitioning was in charge of paying for that. But now we're looking at different ways to spread those resources. I get a lot of things about, a lot of folks say, well, why aren't we doing anything about the heroin in Northern Kentucky? And collectively we are, and especially groups like you who invite us in to talk more about it, to educate the community on what we're doing. We're always open to more suggestions. Our HERT meeting meets the second Tuesday of the month, so that'll be next Tuesday at 9 o'clock. We usually meet at the Kenton County Detention Center. I got an email on the way here that there'll be some police training next month, so we'll be scrambling to find a place. But I'll be happy to send that out because those are open meetings that anybody can attend. So I encourage you to participate in the door hangers if you feel the need, and then also just stay informed with the different things because there's a lot coming down, and I know it can be cumbersome at times. But the folks in this are really in it for good reasons, and at the end of the day, we want to save lives, and we want to save money, because we know we have to pay for this, and we don't want it to be a burden on the taxpayer. How can we invest in it instead of going and doing reactionary measures? It's a little bit about what we're doing with the HERT, and so I'll leave my cards, and I'm happy to talk to anybody or answer questions.
You mentioned transitional living. Are there actually any long-term transitional living facilities for treatment for pregnant mothers in Northern Kentucky?
I don't know about long-term. I know we have a healthy newborn house through Transitions, and that is moms can stay about 4 months. But we're looking at even another, after they're in residential, and then they may get down to this healthy newborn house, there still might be another step, so we're looking at how can we add something in it to really have a continuum of care. Some of the folks, when they're not ready to quite go exactly back into their homes, and depending on what kind of environment, it might not be the best situation. So there are some, I don't think they're long-term enough, but that's something else we need to increase as well. It's a great question.
You kind of,
really quick.
really quick, right? So I was like, oh.
Yeah.
Drug testing in the schools?
Mm-hmm.
What is that? How does that work?
Here in Dayton High School, they drug test the students, and I believe it's through a club.
It's
a
drug-free
voluntary.
club.
Yes, the drug-free club. So it's voluntary.
Oh, it's voluntary.
So the members of that club
Actually,
volunteer.
I don't think it's voluntary.
Oh, it's not. Okay, but it's voluntary to join the club.
It's voluntary.
The club is voluntary,
Yes.
but if you're an athlete, it's random drug testing. Computer pulls so many names every month. Random. Actually, Dayton High School is the first school in Kentucky to mandate drug testing.
Just for people in sports?
I think band, those kinds of things. Yeah.
High school?
And then the drug-free, they can volunteer to sign up to clubs, and they also are drug tested. They voluntarily.
So I'm going to introduce Dr. Savani, so one of our physicians at St. Elizabeth, and so she was going to talk a little bit. I know I talked about the hepatitis C rates and why they're so high with the infection, so she's going to give you more of an overview of why this is so important with syringe access and why, I call it disease prevention is what we should have called it, but so she's going to talk a little bit more about hepatitis C and be able to answer those questions for you.
Just in case anybody wants to reach me. So, do you mind if I stand up and talk to everybody?
Wherever you're going to be.
This is really, really close to my heart. So, let me tell you all first what is an infectious disease. That's what I am. I am not a drug expert. So my thing is risk reduction. It's not, I have to leave the drug care and how to handle an addict to the experts who are addict, who handle that. But I am very, very passionate about what we're doing, what we're letting it happen in our community. In terms of the infectious diseases rampage that is happening around us. And I feel like my hand is tied up and I feel like we're doing nothing. She said she's very proud of what I'm doing. I'm not proud of what I'm doing because all I'm doing is seeing patients who are infected and not doing anything about it. So, what is an infectious disease? You get to medical school, you go to college, you go to medical school. After you graduated, you do 3 years of internal medicine, and you take a board in general medicine, and then you do 3 more years of infectious diseases where you study all the kinds of parasites, viruses, bacteria, everything that you think. And then you take a board, and you hopefully, you never see a case of Ebola in your life, but you take care, you go to work in communities like ours, where you take care of people. You come in the hospital, you have a fever, your GP doesn't know what you have, and then they consulted me, say, can you help me? There is an infection here, I don't know what it is. That's what I do. And after 35 years, after doing my residency, my internal medicine, my fellowship, 35 years later, I'm here today talking to you. So I've been doing this since 1982, and I've never, ever seen what I'm seeing now. I was there in Cincinnati when we had the major HIV outbreak. At that time, we knew it was HIV. We didn't know if we could treat it. We knew how people got it. And this is very, very different. It's frightening to me, who has 4 boys at home. And I say, every single kid that I see in the hospital, I say to myself, this could be my kid. And how could I have prevented my kid of getting this infection? And what I see, for example, today, I have 55 patients in the hospital today. 11 of those patients. This is a major outbreak. 11 of the patients that I saw today are hepatitis C infected. And these young kids, and I can tell you countless cases of young kids who come to me at the age of 19, a pregnant woman who has hepatitis C and is transmitting to that unborn child hepatitis C. This was preventable. That girl didn't have to have hepatitis C. I know how to prevent hepatitis C. I know how to treat hepatitis C. Hepatitis C is 100%, not 99%, under the right doctor who knows what they're doing. We have great drugs for hepatitis C today, and that is treatable. And if you treat a person, let's see, we have 10 of you here have hepatitis C. And if I treat one person, and that person continues to use drugs, but it's now has an undetectable viral load, that person is not going to transmit hepatitis C. So I feel very strongly, if we can prevent hepatitis C in our community, if we can treat hepatitis C in our community, we can be a model if we work together. You know, and I have been in Kentucky, as you can tell by my accent. I'm not from here, but I love this state. And I have been here since 1994. I was trained in Cincinnati, and I started working in Kentucky in 1994. And I came to northern Kentucky. I lived in Lexington for a few years in 1999, and I have been here since. And it breaks my heart. when I see a grandmother, this week I'm going to tell you, and I can go on and on and on, all the cases that I see. But this week I saw a young girl, 19 years old, who has been doing drugs in Northern Kentucky since she was 15, was a sport person, got in contact. It wasn't because she had a bad, terrible problem at home. It wasn't because she was abandoned as a child. She was just a kid in school who got hung up with the wrong people. And one party day she said, oh, this is just one time, I'm never going to use this again. And today, she has a bad heart infection, is intubated in the ventilator, and I'm not sure if she's going to make it. Her grandmother, who flew here from Minnesota, tells me, Doctor, how come we're letting this happen to our kids? This is preventable, isn't it? And I say, it is. It is preventable. This girl, the drug issue I cannot handle, but I can handle. I know how to prevent hepatitis C. I know how to prevent an infection in her heart, and we are not doing it. We have to admit this. We are not doing the right thing for our community. It's a fact, and that really upsets me. And that's why I'm here, to see if I can answer any questions. I can tell you about a patient, not one, not two, and I'm seeing too often. I close my eyes at night and I said, oh my gosh, I can't believe that I'm seeing this. I used to see maybe 3 or 4 cases of HIV in our community. There was drug use. Hear me out on this. It doesn't happen 1 week that I see a patient in the hospital who's doing drugs. It's hepatitis C. And then I ask, are you sharing needles with other people? Yes, I don't have any syringe. I have to share it. But I say, you HIV, you understand, you're hepatitis C, you're HIV. Your viral load is very high. You're transmitting this. If you share this needle with a child who's only 15, you are giving HIV to that person. And I have no other option. And I'm seeing every week, I'm going crazy. And I feel like I'm not doing anything about this. There is a lot of HIV being transmitted in our community, much more than I saw 10 years ago. And I just told you, I have been here since 1999 in Northern Kentucky. And every week it gets worse than the week before, And if we work together, I cannot take care of the drug issue. I don't have the know-how, I don't know. After those 35 years that I've been doing this, my thing is infectious diseases. But I guarantee you, if we work together, we can be a model for the country in terms of decreasing the number of hepatitis C new cases that we see, the number of HIV patients that we see. And I feel like parent after parent, family after family ask me, how come we're not doing more for our kids? And I'll take any questions that you may want. I cannot be more emphatic than this. Help me, please.
This is an obvious question, I guess. So, are there not standard routine tests for hepatitis C that physicians give?
Yes.
Okay, so there are.
There.
So, let's say youngsters go for physicals. Do they get a routine test for hepatitis C?
I do. I do. Any kid that I see, and it's a very simple test. It's very simple.
You're an infectious disease doc.
Yes.
I'm talking about the general population like us. I mean, why is there not a routine?
I'll tell you why.
Okay.
Why the primary physicians are not checking everybody who's at hepatitis C? Because they don't, what you do with that information. Suppose you come to see your GP and they test you for hepatitis C and you're hepatitis C positive. What do you do with that? You have to test, you have to do something with the results of that test. And you have 2 roads. You can be treated, which is treatable. And the treatment is 100% curative in most cases. Let me say 99, just in case I miss 1 or 2. 99% curative. You take 1 pill a day for 3 months, and you are cured from hepatitis. Now, the reason the physicians are not testing, because it costs, I told you, $80,000 to treat that person. And a lot of insurance are not paying for it. I'm a burden in insurance. They all know my name because I call them, I harass them, I tell them, I say, what about was your son? Would you like your son to be treated? And I go on, I don't give up until I get my patients treated. And eventually they cave into it. I still yet to find one insurance who denies me insurance, but it's a lot of work. But this is what I do. And that's why primary physicians are not doing a lot of testing, because they know the cost is $80,000, and it takes hours of someone's time to treat that person. But if I treat you and you're a drug user, you are not going to transmit that hepatitis anymore. Do you understand? So if you have clean needle, you're cured for hepatitis, that alone, each case of hepatitis that you prevent treating a hepatitis, it gets our community clean of several other people, not counting the HIV. That is also increasing in our community, day by day by day. I'm not here to scare you. This is fact. Yes?
So what you're saying is we need to have needle exchanges.
I am a big proponent of needle exchange because that's preventive. Again, hepatitis C and HIV are preventable diseases. No pregnant mother needs to have hepatitis C. No young child, I mean, to me, these kids are children because the age of my kids, and that with the open heart surgery at the age of 19, that is so preventable. And if we would have clean needles, how many cases you prevent from getting infected? How many cases you prevent of developing cirrhosis or developing hepatocellular carcinoma? Those are the complications of, not to say big words here, but those are the complications of hepatitis C. When one gets hepatitis C, if you are treated, you can be cured. Cured, cured, cured. If you are HIV, you can't be cured, but you can control the disease to the point that you are undetectable. And if you are undetectable, you don't transmit the disease. There's several studies in the literature showing us that if you have an undetectable viral load for HIV, your risk of transmission is not 0, but it's 0.003. So it's very small. It's very small. So if, as I said in the beginning, I am here to talk about risk reduction. I can't fix the drug problem, but I can help to decrease the amount of our kids who has hepatitis C and HIV. I certainly can.
So, you mentioned that you're seeing a spike in Hep C and HIV in your patient group, which is infectious diseases.
Yes.
What percentage would you say of those Hep C or HIV cases are because of drug use currently?
I would say, this is a ballpark because I haven't pulled out the numbers, I would say 3% maybe. I have in my office, maybe I should say this, I work at Saint. I don't work for Saint.
Right.
I'm not one of Saint's.
But that's a microcosm of Northern Kentucky.
Yes, I am. I'm too old. That's the problem. And I have been here, as I said, since 1999, and I have 2 other partners, so there are 3 of us in my office, and we see all the HIV patients in Northern Kentucky. Actually, I used to work at UC. I was part of the staff there. So some of my patients from UC from 30 years ago come to Northern Kentucky to see me because I have been taking care of them since then. I worked in Lexington between 1994 and 99 before I came here. So my patients from Lexington drive to Northern Kentucky to see me. So I have the majority of the HIV patients in my office. But we have roughly, just our group, which is the only group really doing this in Northern Kentucky. This is roughly, this is not absolute numbers, but around 430 HIV to 450 HIV patients. About 300 of those are my patients, because I'm the oldest. And then the rest, my other 2 partners. So in my case, It's about maybe, I would say maybe 2%. But the ones that what's really frightening me is the ones who are HIV that I'm seeing in the hospital. They are now my patients in the office. I mean, I've seen HIV patients for 30 years. They're doing great. They are working, being productive members of society, they're paying taxes, and they're living a totally normal life. Quite frankly, in 2017, it's better to have HIV than have diabetes. I don't know if any of you have diabetes, but it's a worse disease in terms of control and complications and consequences. HIV patients today, 1 pill a day, live a total normal life. They become, the viral load is undetectable, and they're not infectious to others, and they live a total normal life. Now, hepatitis C can be the same if you are treated for hepatitis C. As I said, it's easier because it's only 3 months therapy. HIV is lifelong. So the frightening, those 3% that I'm telling you are not my office patients. Those are the patients that I'm seeing in the hospital. There's a girl who's right now in jail. I've seen her I don't know how many times, and I begged her to come to my office, and she hasn't come. She is co-infected with hepatitis C and HIV, and she is sharing needles with a lot of people in Kentucky, not infected, and she's transmitting both. And my hands are like this. What do? I mean, I lose my sleep over it. There are young kids out there in Kentucky getting HIV and hepatitis C from this girl that I know. This is just one that now came to my mind. She's in jail right now, so it's good. She's, at least I'm hoping that in jail she's not doing anything. I hope they keep her there for a while, but I shouldn't have said that, but anyhow. Bottom line is, it's a real problem. And I think we can't be sitting thinking that this is a problem out there. And a lot of these people, and this is, I think we need to stop for a moment to have compassion. Those people, they're sick. They're sick people. They're just like the same thing as they have a heart attack, or they have some sort of a brain tumor. I don't know, whatever. But this is sickness. They're sick. We need to be compassionate about these people. We need to help them, and helping them, we're helping our community and preventing other people getting infected.
So what can we do as a city?
I can tell you what I think you should do. And I'm not
Go first.
I'm not a political person, and I'm not politically correct, so forgive me. Is there a reporter here? I hope not, right? Because last time I spoke about this was many years ago. Rich McConnell came to speak with us, and I got up in the middle of his thing. Many of you may have seen it. I asked him about this. This is 15 years ago. I have been worried about this for 15 years. I don't know what it was. He was running for re-election, so this was well then. And we had a meeting in Florence, and all of us physicians, and I asked him, I did not know there was a reporter in the room, and I said, what we're going to do about this hepatitis C outbreak and risk reduction. I'm really concerned we can decrease the risk of patients with HIV and hepatitis C. And then he said, oh, this is not a problem for me. This is a Frankfurt problem. He was running for the Senate. And the Inquirer, the next day, I see my picture in the Inquirer, and the Inquirer published what he said. And I was really upset because I didn't want to be in the newspaper. So, having said that, how can we control this? I think we need to work together. And that's why I'm here today. Now, I stopped everything I was doing because I feel like I owe the community. Seeing these patients dying, seeing these patients on the ventilator, seeing these patients getting endocarditis, getting HIV, getting hepatitis C, what preventable disease, and me not doing anything, just seeing this patient the next day, go to my office and do the same thing, it's way on me. So that's what I'm here today, to try to see what can I do. And what I think we should do is a combination of all of us working together. I love this estate. I love the community of Kentucky. I love working here. And I wish we could become a model for the rest of the country if we work together. And what is that? First of all, again, I said I'm not politically correct. I think all the people who sell drugs should be in jail forever. That's right. I think they should. We need to enforce. People who sell drugs and get these young kids, because a teenager doesn't have the mind, they don't know how to handle this. And then you introduce, decision makers, this is something that they think it's just a one time, I'm not going to get hooked on this. And forget it, one time you're hooked on this, and then it's this, and then it's more, and it's very hard. This is a disease. We need to see heroin addiction, or any kind of addiction for that matter, as a disease. And we need to give to these young kids and anybody else the tools to get off of it. Drug dealers should be in jail. We need the law enforcement to work with us, and I see there was a grandmother who came in the hospital, and this kid had a horrible infection. He was trying to get his heart, he had a lung infection, a heart infection, a shoulder infection, a knee infection, all related to dirty deals. And we're trying to keep this kid alive. Grandmother comes in the hospital and she shoots heroin. The kid goes into full arrest. In the hospital, the grandmother is passed out on the floor. I mean, this is the thing that happens every day in the hospital. And I get goosebumps talking about it. This is true. I mean, I'm not making this up. I can't make this up. I mean, how can you make something up like this? You can't. And we call the law enforcement and we tell them the whole thing, and they say, "Oh, there's nothing we can do." And I just get furious. I mean, how can you say? I just told you. I saw the shooting. I walked in the room with a needle, and there's nothing we can do. So I think we need to get tougher on these people who are doing this. I mean, that's what I think. I think we should provide clean needles to people who are using drugs. Why? Risk reduction. We decrease the rate of HIV, we decrease the rate of hepatitis C, and I have not even talked about hepatitis B. The younger kids, a lot of times they won't get hepatitis B because thankfully we have a program in place that all the little babies that were born after 1987, 86, all vaccinated against hepatitis B, which is a great thing because they are not getting. The people who get hepatitis B through needle shooting are the older people, 30 plus. They still are getting, but the younger kids are not. Most of them are immune to it because they get 3 doses of vaccine when they're very little. And when these kids come to get their needles, they get counseled. They get their, again, I'm not the expert. It's a Suboxone, the Vivitrol, whatever it is that the drug experts give it to them to get them off the drugs. But then they get counseled about hepatitis C. They get treated. They're referred to me. I treat the hepatitis C. They become hepatitis C undetectable. Even if they share needles with other people, they won't transmit it. And I'll test them for HIV. And if it's HIV, I'll give them medication. It's 1 pill a day, very easy to take. They won't transmit HIV to other people. Do you understand? So that's what I think we need to do together. And I guarantee you, my license on it, we decrease the number of hepatitis C and HIV in our community. I can't tell you anything about the drugs because, as I said, I don't have the know-how. But risk reduction is with me. And that is my number if you want to talk to me anytime about any of this. Questions?
I just wanted to check. You said all the new cases of HIV and hepatitis C, it's 3%.
Well, this is a ballpark. I'm thinking about here, if I see, I told you today I had 11 patients in my census in the hospital who are hospitalized with hepatitis C and other complications of drug use.
So is the rest of it unprotected sex?
Oh, the rest of the people?
The 97% new cases, or
Yeah.
whatever it is, 90?
Yeah.
Okay, shouldn't we be talking about that too? That's like a giant crowd of...
Well, it is, but as I told you, I have been doing this for 35 years. And if you think it's hard to talk about needle exchange and risk reduction, hepatitis C, talk about sex.
I know.
It's much harder.
I know, but so what? We're all going to die. I guess so what? You know.
But behavior, it's much harder. So I think I know how after 35 years doing this, I think I take baby steps. Yes, I talk to every single patient that I see about safe sex. Every single patient, every single kid that I see about that. But I think right now, the majority of the cases, new cases that I'm seeing, is related to hepatitis C, HIV in the hospital. In my office, the health department knows, they refer all the patients to us. We are seeing a lot of people being incarcerated because of all the foreign people get incarcerated, and then, I mean, they come to see you once and then they're deported, and so there's a lot of HIV in the prison. And I don't know how these people do it, but they manage to get drugs in the jail too. And, you know, so it's a major issue. So I'm tackling what I can right now. But yes, there are other people, the majority of cases of HIV still is unprotected sex.
I can say, I'm Stephanie Vogel, I work at Northern Kentucky Health Department, and we do a couple of things. One of the things that the health department is tasked with by law is receiving reports of infectious diseases and communicable diseases, of which hepatitis C acute is reportable to the health department, as well as HIV also gets reported. So we see numbers on that, and then, so not only do we take numbers in, but we also do contact investigations and then partner notifications for some infectious diseases as well. One of those being HIV, and we also do testing in our health department as well. So we kind of hit lots of different prongs for folks. But one of the things that we're starting to notice, and we'll be investigating this a little bit more, is that the last few folks that have come into us that have been HIV positive, which we see about 25 to 35 cases a year of new folks living in Northern Kentucky that have HIV throughout our 8 counties. Is that we're starting to see a shift. Like there's a little bit more than what we're used to seeing that are identifying injection drug use as a risk factor. So we're going to be digging into that a little bit more. I think we'll have some more answers.
I'm seeing
for you
much more in the hospital.
Right. So I can definitely tell you that is something we're looking at, and just anecdotally, you know, without having hard numbers in front of us, we're starting to say, you know, that person and that person and that person, and that's usually we might have a few cases a year that say their injection drug use is a risk factor. And now it's starting to be, oh, well, that's just 3 in 2 weeks. So
I know I have, on top of my head now, 3 patients that I know that are hepatitis C, drug user, and HIV who are in the community and they are sharing it. I know 3, and I can't hold them. I can't make them hostage. I mean, I have their rights. And I talk to my partners, and I know my partners also have. So just imagine, it's just an atomic bomb waiting to, yes.
Francesca, I work for an agency that provides residential IOP and OP treatment, and of course it's a targeted population, it's all women, and it's targeted because they're in recovery, but we have at least 40% who are positive for hepatitis C. And they're not in the hospital. They don't even often know they have it until they come into our program and they're tested and all that, but it's a really high rate.
Oh, yeah.
And I know it's from needle exchange and probably sexually transmitted as well.
Yeah.
So, but as you said, the treatment is so expensive, and the waiting list to get the treatment.
But it's treatable. The insurance have become better, and some of the treatment are cheaper. The new ones just approved have become cheaper. And like everything else in this country, it takes a lot of us, and a lot of us saying the same thing over and over and over to get to where we need. For example, the VA, it's already treating everybody. Every single vet who has hepatitis C has been treated. That's a great thing for all the veterans. England, the United Kingdom, now their national health just approved hepatitis C medications for everybody, every single hepatitis. And I guarantee you, in years to come, this is going to be the norm. Hepatitis C has become, the treatment is going to be available for everybody, but we're not there yet. But if you pursue, if you become relentless and you do not let the insurance to refuse you, I mean, that time that I submitted papers 3 times, and I do peer-to-peer, and I call them, and I, and I appeal to them, and eventually I get. And the way I do it, I have the medication sent to my office, and the patients have to come to my office, and I give them the medication, and I see them take it. It's 1 pill a day. So you have to be motivated to get treated, you have to be motivated, and so far, so good. But it takes an effort, which is okay with me. Yes?
Yes. Well, I don't understand how we as a community can do anything to combat this problem when, you know, you as a physician are saying that you know people you have patients who are intentional, knowingly sharing needles, and they have, you know, they're basically committing attempted murder. Now, how are we as a community supposed to combat that if they're not suffering any legal repercussions for their actions? I mean, I'm sorry, and I'm certainly not saying every case, but people that do that are not sick and do not deserve our pity. They deserve to be prosecuted. I mean,
I think, if I could, because this could go on for 6 hours.
And I can talk and talk and talk.
So can I, he'll tell you. As you said in your presentation, this is a multi-pronged. It's not just,
Right.
it's prevention, it's law enforcement, and Gene Cole and I have talked about this in the past. Would it be beneficial to our community to maybe lead the way by having a community-wide, open to the public meeting, not in this forum, because obviously there's nothing the city council can do. Some of the programs that you have available, many people don't know about. You may be able to save a few cases and get some people into rehab just by making that exposing that to at least our population. Would you be willing to do that? And do you think it would do any good? Put it that way. I'd be willing to help organize it.
Yeah, absolutely, and I think that's kind of been an ask of ours too. You know, we did town halls when we first started HERT, 3 years ago, and it was like, okay, shock and awe. You guys already know the shock and awe. You already know that it's in our community. But I really think that there's a lot more, like Dr. Bonnie, a lot more education that we need to be doing now that the community needs to know about. So if
you've
you
had these
did
town
that, absolutely.
And what has the turnout and benefit of those been?
Well, in the past, it's primarily been the parents and the people that have been affected by it in their community. So I think we need to look at it a lot differently, and that's why we have Lisa and Bonnie on our team at St. Elizabeth, because I think that we need to look at it, like you said, and we want to talk to you about treatment options and what treatment's available, and then about hepatitis C, infectious disease, and how you guys can prevent it, and law enforcement piece. So it's not just the health piece, it's really, like you said, all the disciplines. But the community, I think, needs to know what law enforcement's doing in their community about it, what EMS is doing, what healthcare is doing. Because it really, like you said, yes, you already see the data, you read the newspaper, you see it every day in your face, but what's really happening in our cities and communities, and I think it's helpful. But again, the turnout primarily is the people that are affected by it, not necessarily, the others. But I would welcome it, absolutely, any of us would.
And maybe we can drive it through the schools. As Mr. Volter said, we've got a groundbreaking drug-free club here to get those kids involved. I think that would probably be the likely next step in this. And then we can talk about other options that other communities are doing and how we can implement them here.
Absolutely.
Because we're very limited in our resources. And we're not the worst community out there.
Right.
Everybody.
But that's to prevent, isn't it? You don't want to become.
No, I'm talking about all phases.
If you diagnose, treat, and prevent, that in itself already decreases the number tremendously.
Understood. As far as the infectious diseases, I'm talking about the from the beginning, from somebody who's not using, and the opiate drugs, OTC drugs, all the way to what you see as an end result. I think that's the whole package that needs to be discussed with the public more.
And we'll help support you in any way we can, just like that.
Okay. Do we have all of your contact information? You have all of ours, I'm sure.
Yeah. Scott will reach out to you on our next steps on how we can help you accomplish that. Absolutely.
That'd be great. I'd like to do it sometime, but definitely soon, especially while school is in before the holidays. I'd be willing to do that, definitely. And with Jean Cole, I know she's been a champion on this cause too, as well as some other residents that are in the industry.
Well, thank you. I know we took up a lot of your time, so we appreciate it very much.
Oh, thanks for all the work you guys do. And all of our email addresses are on the city website, by the
You're
way.
welcome to leave if you don't want to stay for the meeting, because it's going to be a while. You might want to get out of here.
Thank you. Thank you. Thank you very much.
Yeah.
And I left my number there if anybody wants to, that's my office now, no one can talk to me.
Thank you.
Thank you.
Next on the agenda, anyone would like to address city council, get up to the podium, give your name, the podium, give your name and address, and you can address council.
Yes, my name is Ken Henson, 119 4th Avenue, and I'd like to see what's going on about my property, that the road beside me, the damage to my furnace, my drains. And I talked to Michael about 3 weeks ago. He's supposed to get a hold of the developer.
Yeah, I mean, as I told you on the phone, the last time that I saw you, you were talking with the developers out there for 30 minutes or so. I didn't know what you all had come to an agreement on, or if anything, so you two were the last people to talk, so I don't know.
Well, they kind of disappeared. I ain't seen them over a month, Bill went back here.
Yeah. Brendan Sullivan hasn't been here, Jim Reed was here right about the same time that you stopped in my office, but, you know, you were the last one to talk to him, you talked to him personally, so I'm gonna let you all talk.
Well, I turned them into my homeowners. We made a mention, they won't touch it. They said, do the heavy equipment, the city owns the property, and all the heavy equipment, gravel was poured there. They can see there's no drainage, and the water's gotta go somewhere in my basement. Like I said, it's gonna get cold, I'm gonna need a furnace. What should I do? Should I call the fire department before I start my furnace up?
I can't tell you what to do.
Well, the city owns the land.
No, you wouldn't call the fire department for that, that's for sure. Because everyone know what to do with it, other than turn it off. You don't service, we don't service.
I need service just to protect my family, in case when I flip that switch on, it doesn't catch on fire. And the city owns the property.
Yeah, but the water's going into your basement from the hole on your property, on the downspout that's broken on your property. That's we've been.
I'll get a letter from the insurance company, and they show you top of the road, the water's coming down into my property, and that's causing the flood in my basement. So, I don't know if you guys want to fix it, then collect money from the developer or what, it's your property.
Well, at this point, the city's not gonna take any action on this. So we've told you on numerous occasions, you've been here about 4 or 5 months in a row. We've told you from the get that the city's not gonna take any action because it doesn't believe that it has any liability. The developer's been nice enough to be willing to work with you. If you wanna work with him, that's fine. That's not our stick.
Right.
That's between you and that developer to figure that out.
I mean, I gotta go chase the developer down.
That's between you and him. The
I
city
don't have no number.
The city is giving you the numbers to him, it's giving you the emails to him. At that point, that's between you and them. You spoke with them last. At that point, the city is, you've heard our position of where we're at, nothing's gonna change.
So I might as well take my money out of my pocket and fix my drain and everything.
Yeah, I'm just telling you that this, the city's position.
I
What
think
you
the city's
decide to
gonna get
do,
involved in this.
what you decide to do at that point, it's up to you. And that's fine, and we're happy to hear your comment there, but
I'm glad
there's
you-
not any action that we're gonna.
So I'll report it to the paper and see what the paper has to say.
I'll bring a copy of from my insurance company showing where, when they put the road in, they didn't put no drainage. Anytime you put a road in, even 75, they put a drain. They put that road in the side of my house, and there's no drainage. Where does the water go? In my basement. So whose fault is that? Is it mine?
Well, the city is not liable for it. We've said our piece about it, and at this point, there's no further comment that you'll get from the city.
Okay. The city's property, so they should come out to the developer and fix it.
Thank you.
Thank you very much, guys.
Never was like that, you don't mess with it.
My name is Marcia Hooley. I live at Spears Court, and my fellow tenants and I are very concerned about the drug activity that is permitted to go on in the building. 2 weeks ago, I called the police twice in 3 nights because of the marijuana being smoked on the 2nd floor. It is so bad that, it comes down to my apartment. And my poor little chihuahua was stoned all the time. The police that responded to the call said that he could smell the pot when he came off the elevator all the way down the hall. He approached the apartment that was in question and smoke billowing out all over the hall. Nothing is done about this. This has happened, it happens all the time. I'm to the point, I'm so frustrated with it that I don't even want to call anymore. I mean, what's the point? And we would like to know why this isn't being addressed and dealt with.
Well, I think the chief would probably agree with me here. To a certain extent, misdemeanors, if they don't happen in the presence of an officer, there's a limitation on what they can do.
Even if the cop they open the door and
they have to see that all the elements to the crime occur before them for any kind of misdemeanor arrest. Now, the other opportunity that may be available to you is if you do see, you may be able to file a police report and then take that report down to the county attorney's office if you personally observed all the events that occurred in the misdemeanor for the misdemeanor offense, and you might be able to get them to take that as a criminal action through the county attorney's office as a private complaint. And the police will probably be happy to explain whenever they're called down there that scenario, as they're all familiar with how that works as well. The other option that might be available to you is, it sounds like, because it's at Spears Court, that is a landlord-owned property that all you guys rent. I believe if several of you are having problems there, I believe you probably command some power with respect to the landlord to try to motivate the landlord into fixing the situation. And I would be on his doorstep, or his or her. I think it's a company that owns it, but it's a guy that runs that building. Well, a lady that runs the building, a guy that runs the corporation that owns it. But I would be on their doorsteps too. I know they're not the most responsive, just from experience.
But I mean, I've called HUD. I've called Fulker's Management. I've even called a reporter from Channel 12 News.
Yeah.
We've pretty much exhausted every recourse that.
I understand that. I know this works for me. I also work in the child support office quite regularly as an attorney for the child support office. And you know what the best tactic is for me collecting child support? It's not there's a lot of opportunities that might be available to me, but the one that pays off the best most often is persistence. It's repetition, persistence, that I keep calling that landlord, I keep doing this, I keep doing that. If I'm seeing criminal activity, that I'm taking action against it through elements with the landlord, with the police, with the private complaints. And you might not break them today, but you may break them down the line. I know that's not, I can't offer you any more than that, and I'm sorry, and I wish I could, but that's the advice that I can give.
Can I, ask the police officer that he, there's a lot of drug activity right out in the parking lot in broad daylight. I actually called the cops one time, and the cops sat there. I'm looking out the window, gave them the license number and everything, and the cops sitting there at the back door and watched the car pull out of the parking lot and leave, and didn't even go after them. Is there any way that we could have, more of a patrol around Spears Court where...
We patrol it all the time. We can't just, as you say, the drug activity is going on. I have to witness the drug activity for us to stop the vehicle. If the officers are there, they're going to make an arrest, or if they have probable cause, they're going to make some type of action. If you go into a second floor and the whole floor smells of marijuana, we have to figure out which door that's coming to. If somebody doesn't answer that door, we can't pinpoint where that's coming from. We can't just walk in people's apartments. You just can't do that.
Okay.
So, if we would act, if there's stuff going on and we see it, we're going to act on it. Now, just because somebody, like I said, I give this case before, we get constant complaints of drug activity down there, and we go down there, we'll sit for a long time, and we see nothing. Nothing. And we had a complaint of a black gentleman with Ohio tags carrying a black purse. That was the biggest thing. He had the satchel. Well, he's dealing drugs. He's dealing drugs. Well, we stopped him one day, and he had hair clippers. in that black bag because he was cutting people's hair. He would go in there and cut hair. But people assumed since he was a black male, he was from Ohio, he kept coming in and out, and he was carrying this little bag, that he was dealing drugs. So you can't assume. You have to have positive evidence. You have to have probable cause to act. We can't, I know you're telling us that it's happening. We have to see it happen. There are so many people coming and going out of Spears Court during the daytime hours. It's pretty much impossible for us, not even Spears Court, Transitions, the whole city of Dayton. And there's only 3 of us on, if 2, you know, all during those daytime. You know, we have to be there at the right time, you know. But if there's something going on and we see it, we will act. We don't just disregard crime and don't do anything about it. We're not about that, you know. But it's just, we do get constant complaints from Spears Court of people in the back parking lot, people in the front parking lot. But we have to see some type of transaction or something that goes on for us to act. We have to see it ourselves. So you guys are there 24/7. We are not. We have the whole city to patrol. We can't just stay there all day and wait for something to happen. We just don't have it. Now I've contacted, I guess, some complainants that came in, and I gave them the Drug Strike Force's number to give them, because they had names of people and cars and all that other stuff. You know, whatever transpired with that, I didn't hear anything, so we asked for help from them. So, I mean, we do reach out, but if we continually have complaints of search with the same car every time, same plate, you know, then we ask for help. We're not bashful.
Okay. Well, thank you for
We'll try our
letting me
best.
speak my mind.
Okay, not a problem. Thank you.
Thank you.
Thanks. Anyone else from the audience would like to address the council? All right, moving on. Approval of minutes from the July 18th meeting. Need a motion?
Make a motion, we approve the minutes for July 18th and August 1st.
On the August 1st after additional.
Yes.
Second. All in favor? Aye. Need a motion for August 1st minutes approval?
So moved.
Second.
All in favor?
Aye.
Opposed? First reading ordinance number 2017-16, tax rate for 2017-18.
City of Dayton adopted ordinance 2017 number 16, an ordinance providing for the imposition, levy, collection, and appropriation of taxes for the city of Dayton, Campbell County, Kentucky for the fiscal year July 1st, 2017 through June 30th, 2018. This ordinance sets the real property ad valorem tax rate for the city for the present fiscal year at .4950 for $100 of value for real property, .5009 for $100 of value for automobile personal property, and at .750 for $100 of value for all other property. Of that amount, the real property rate will go to the general fund. .0500 of the real property tax rate will go to the park maintenance and construction. .5009 of the automobile personal property tax rate will go to the general fund, and .750 of the other personal property tax rate will go to the general fund. It sets the bank deposits at 0.25% of those deposits. The payer of these taxes may pay the sum due less 2% if paid by December 31st, 2017, or the full amount by January 31st, 2018. The above taxes may be paid from the 30th day of September 2017 at the office of the city clerk treasurer and shall be delinquent after November 8th, 2017. A penalty of 10% and interest at the rate of 12% per annum shall be charged on the account of such tax from November 9th, 2017, for as otherwise provided by council by order to the date of payment.
The first reading. All right. Order number 2017, number 10R, agreement with GRW Engineering.
City of Dayton, Kentucky Municipal Order number 2017-10R.
A municipal order of the City of Dayton, Kentucky, authorizing the mayor to execute an agreement with GRW Engineers for the design phase of the Dayton Safe Routes to School project.
Any motion?
Make a motion we adopt order number 10R.
Second. Any comments?
I have a comment, sir.
Go ahead.
This is for the design on the sidewalks, sorry, sidewalks on Sixth, correct?
And
Dayton
Pike.
Both.
Yes.
Right.
I would like to know who's going to be involved with the design phase, because I don't want this to come to council with one design and a yes or no. I'd like some community involvement. I'd love to be involved in it. Perhaps Main Street Board should be involved in some of the design elements.
Yeah, we'll have a stakeholders meeting similar to what we did with Riverfront Commons. We'll invite in a couple council members if you all are available. Stakeholders on the, in this case, the Avenue and Dayton Pike, those that are going to be directly impacted by it, and other members of the public. So yeah, we'll set the stakeholders.
I'd like to see something like we did for the pier with KZF when we had the open meeting here to the public. And I think they got some good, and at least people felt like they had a chance to give their input.
Yeah.
Thank you.
Anyone else? Just a roll call.
Member Volter?
Aye.
Member Burns?
Aye.
Member Neary?
Aye.
Member Lynn?
Aye.
So ordered. Next orders, order 2017-11R, Safe Route to School project.
City of Dayton, Kentucky, resolution number 2017-11R. A resolution to adopt agreement with the Commonwealth of Kentucky for Dayton Safe Routes to School project.
Any motion?
I'll move. I'll
Yeah.
second.
Joe. Jeff and Joe. Any comments?
Time frame? It's more question than comment.
This is all related to GRW Engineers, obviously, so.
Understood.
Now that we've got this passed, we'll send all the stuff into the state, and then we'll start setting up. We've already met with them before, so it's not like they're coming into this cold. They've understood what we're going to do for a while. So it's just a matter of hearing it back up, and we'll have a meeting with them. I'll have a phone call with them sometime this week or next week, and we'll be doing that. So I can't specify a time frame other than originally their scope said, I think, 8 to 10 weeks. Bob, is that right? Or maybe it's 10 to 12 weeks for design, so that's what you're looking at for a realistic design, so that gets us into the winter time and construction in the spring.
Okay, well, with this safe sidewalks going up Dayton Pike there, we're incorporating the Jamestown Pike Park,
Correct.
right, which is freeing up down there on the river.
Safe Routes to School goes from 7th to Chateau.
Right.
In between, you've got, it's going to run through the parkland as well.
Where's the design for that park?
The design for the park's already been done, it's submitted as part of the park conversion.
Okay, and what's the time frame? I know it's a separate subject from this motion, but the time frame on that coincides with the sidewalk grant.
Correct, yeah. So right now, everything is pretty much complete for the park conversion. I think all the documents are signed. The one thing we're waiting on is a survey from either Cardinal Engineering or another firm is going to do it. We've just gotten some quotes. But they're doing all, it's really all the legal stuff now. And once it gets filed, the restrictions lifted, and we're good to go. So, I mean, the restriction will be lifted here in the next couple of months. It's just not a big difference.
When was that park design done?
It was done when we had to submit the report to National Park Service back in spring of 2016.
Can you share that with us? Because I don't recall having seen that. I remember seeing the conceptual ones, but no final design. Because I want to make sure there's a swing set or something there to make sure it's a playground, classified as a playground.
It's a passive park. It's going to be a passive park for people to walk, be able to sit down, read a book.
That was one of the reasons we wanted to put it there, to get the 1,000-foot radius.
I mean, you can put a playground in. I'm not saying that's not. We submitted it as a passive park.
I don't want to hang this whole thing up on a swing set, but eventually I want to see that classified as a playground because of the 1,000-foot radius.
You can put whatever you want in the park. What we submitted it as was a passive park, and that's what we submitted to the National Park Service. Down the line, council wants to.
I never saw that design. I'm sorry. If you would share that with all of us, I'd appreciate it, or at least with me. Thank you.
Anyone else? Roll call vote.
Member Burns?
Aye.
Member Neary?
Aye.
Member Lynn?
Aye.
Member Wilson?
Aye. So ordered. Next on the agenda is 2017-12R Transportation Alternative Program Funding.
City of Dayton, Kentucky, resolution number 2017-12R. A resolution by the City of Dayton, Kentucky to support transportation alternative program funding application.
Need a motion?
I'll move to accept.
Motion by Joe,
Second.
second by Jeff. Any comments? Roll call vote.
Member Neary?
Aye.
Member Lynn?
Aye.
Member Bolter?
Aye.
Member Burns?
Aye.
So ordered. Next on the agenda is 2017-13R, Second Amendment to Restart Development Agreement with DCI.
City of Dayton, Kentucky, resolution number 2017-13R. A resolution of the City of Dayton, Kentucky approving the Second Amendment to the amended and restated development agreement.
Need a motion?
I'll make the motion.
Motion by Denny,
Second.
second by Bill. Any comments?
I would have made the motion to table this, except I know what the urgency is here. We got this at 3:21 this afternoon.
No, you didn't, Joe.
We got the
No,
final
Joe,
version
no,
this
Joe.
afternoon. We
You've
got
known
one
about
last
this-
Tuesday.
You've known about this for a week, a full week, to ask questions. Don't act like you got it today. You didn't.
We got the final version this afternoon. My question on this is, in, what was it, 2012, in the May meeting, it was 3-3 and the mayor broke the vote on the amendment, I recall that. And one of the reasons was because of so many changes at the last minute that weren't well explained. I don't have all the time in the world during the day because I work to ask all these questions, but my primary question on this is, what happened to the Berry Street connector?
Go ahead.
What's the status on that?
This is Paul Darfel. He'll speak for DCI.
Yeah, my name's Paul Darble. I represent Mark Stark, MBS, Nelson Stark, the new entity, actually Manhattan Harbor Project. Basically, nothing's changed with the Berry Street connector or anything like that. Everything else remains the same. We fully intend to, right now, work with the city and get that Berry Street connector finished, the same way it always is. There's nothing changes. This doesn't change any of that. Basically, what this is, in our opinion, adding financial stability to the project, just shoring up the individuals that have been working on it and defining roles, essentially. And initially, what will happen is we're trying to get the east to west done first, get the development in, get the people, find out where it is, and then work with Berry Street, to make sure that there's households, there's things up there to get to, quite frankly, and that makes the way to pay for it as well. There's revenue there as well. So nothing changes as far as I know with Berry Street. This does nothing to the Berry Street connection.
Everything that's in the other sections, the development agreement stays in place.
Yes. This only changes what's in front of you, essentially. We've created a new entity, Manhattan Harbor Project is what it's called. MBS Development Company is partners with David Wood, who you all know. These are the folks that have been involved with this for years and years and years. Nelson Stark is the company you all, I'm sure, have seen the trucks. Over the last 12 years, bringing the dirt in. We got over 1 million cubic yards of dirt now. It looks like things are really actually about ready to take off with this project, not grumbling. I don't want to jinx us. But, so we need to just get the roles defined, need to get the proper parties in, secure their interests the right way, and that's really what this does.
Well, my concern on this is that my understanding was in the first amendment in 2012, that was the previous amendment was in 2012, correct? I thought that there was a listing of priorities for what the developer would pay for, and the first one was to complete the road, the second one was to repay some of the TIF money, the third one was the Berry Street connector, and then the fourth one was the city community center.
No, the first two were to reimburse the development for the road. Second was to acquire the Queen City lease. Third was for public parking.
Right.
Fourth was city road. It does mention the Berry Street connector in other sections of the development agreement, both 2012 and the original in 2009. what it states in 2012, if I'm correct, was that it was left up to council to decide if they wanted to put that connection in there. And I think it was in 2014, it was around the election time, the council voted to do that. But that still remains in place. That section of the 2012 agreement isn't being changed here.
Okay, because I consider the Berry Street connector more important to this city's vitality than anything else, getting it connected to the river, and to the success of the riverfront.
We don't have any objection to Berry Street connection, any problems with it. This doesn't, in our opinion, change anything that's been anticipated with that.
So Mr. Gardner or Tom, I guess, I'm looking at section 1 on page 2, which basically says that the first agreement and First Amendment shall remain in full force unless it's been modified. So if Berry Street's in the first agreement and there's no modification in this document, then it remains.
Correct.
Okay.
Yes.
Okay. As long as it's a matter of record, that's what I wanted to get it on.
Absolutely. Put it on record that we have no objection to anything that we haven't changed. In our opinion, we're not changing anything on Berry Street.
Understood.
Yeah.
No, sir.
All right.
Let me just say, in our opinion, we're not changing anything at all. Quite frankly, this is just a financial situation. Mark Stark and I and Nelson Stark Company have for years been running this project on a handshake, quite frankly, because I've known Mark for 30 years now. It was 20 when we started this, you know. But it's been about 30 years. And basically, one day we're sitting around talking, he's like, what happens if you die, you know? And I'm like, well, my dad will come up from Florida and you can work with him. And we laugh because he's 92 years old. And he's like, man, we need to start getting some protection on this, you know? If I did die, then all of a sudden DCI would go to my dad, you know? And so we started, that's how it all started. Basically, Mark and I have been partners, you know, since that dirt started coming in years ago. And now it's millions of dollars of dirt, et cetera. And it's just to protect everybody. But the development agreement, we're not trying to change anything at all. I want Berry Street to go in. That's very important to me because I don't want the traffic to come through the single-family houses. I want the marina traffic to go to Berry Street, turn left like we always said, you know. And then I think that'll spring the whole Dayton front, you know, the whole Dayton Main Street. So, yeah, all this is just restructuring where we are and getting some security for Stark that basically has been a handshake for years. Which
I understand that.
It's making the attorneys happy.
And, yeah, making attorneys happy. And I'm still here. I'm still the face of it. I'm still, you know, Mark and I just become partners basically. And, you know, if something did happen to me, there's a lot of strength, including Paul, that he's part of the team also. So now we've got, if something happened to Mark and I, then you know, a lot of people got to fall off before it comes to an end. So that's all this is about.
No, I just wanted to clarify.
The development agreement stays 100% intact.
My concern was the Berry Street connector, the omission in this new one where it wasn't the previous one.
I wanted it more than anybody probably, because I don't like that traffic going across that front area there. Roll call.
Member Lynn?
Aye.
Member Bolter?
Aye.
Member Burns?
Aye.
Member Neary?
Aye.
All so ordered. Next on the agenda is 2017-14R capital expenditure reimbursement.
City of Dayton, Kentucky Resolution 2017-14R. Resolution declaring the official intent of the City of Dayton, Kentucky with respect to reimbursement of temporary advances made for capital expenditures from subsequent borrowings.
Yeah, I want to clarify, and I sent this out in an email a week or so ago to explain, but I want to reiterate again in case there's some confusion. This is in relation to the building of a new city building. This does not lock you into any sort of financial obligation. What this merely does, after speaking with bond counsel, it allows us to lock in any capital expenditures that have happened between now, if you were to pass this resolution, and 60 days prior, to include that into financing should we go forward that in the future. What those capital expenditures would be the purchase of 505 Berry, $65,000, and the demolition of the property for the amount that you approved at the last meeting, I believe. So essentially what it does is what I said, allows you to capture those costs. In fact, we do move forward with financing for this project in the future. It's just an opportunity to spread that out over a longer period of time.
And it doesn't even mean, and just to add on to Michael's saying, it doesn't even mean that we have to recapture those costs if that comes about. It just puts the option on the table under the federal law, we have to at least pass this resolution, this declaration, to have that opportunity. But we're not locked into doing anything. We're not even locked into recapturing those costs.
So let me ask a question.
Let me get a motion in a second now. Okay. I need a motion.
I make a motion, we adopt 2017-14R.
Motion by Bill. Second by Jeff. Comments?
Okay, so the way I read this, and you mentioned the purchase and the demolition, we have to pass this resolution. We've got 60 days from the point in which we pay for those services
To have this
to pass this
resolution.
resolution.
Yeah, if we want to.
And then we have 18 months from that point, is that correct?
Correct.
Float the bond.
You got it. Yeah.
Okay. All right, so I guess one of the things I personally would like to see is to put this off as long as possible. Now, the resolution, I'm not for it and all that, but my reasoning is, when you look at the other issue that we just passed, I mean, that money could come in anywhere between now and 2025, right? So I'm thinking to myself, you know, if we could push this out a couple more months, that gives us that much more time. It's just a thought. You know, I'd like to know what the rest of the council feels about that, but, I mean, we're not gonna pay these people till they tear down the property, right?
Yeah, and that's it. And that's the thing, is because we've already paid for the property, the 65-day, or that's the reason we went ahead and put it now. It's because we've
Oh,
already.
so it's not a package, it's a separate entity?
Yeah.
So 60 days from the purchase of the property?
Yeah,
So we have to do that? Okay.
Yeah,
All right.
that's why we're.
I thought maybe all those expenditures could be rolled into one.
No, unfortunately, it's
Okay.
from whatever date that expenditure is, hence why we're doing it.
Okay.
Anyone else have any more comments?
I do, sir.
Go ahead.
You know I would. What's this $3 million? By representing a borrowing by the issuer in the maximum principal amount for such reimbursement of approximately $3 million. Section 2, letter B, actually. That's what scares me about this whole thing. And the other issue is that $65,000 that we paid for 503 Berry. I know it's not a matter of public record because it was discussed in the executive session, but I made it very clear that I wanted that $65,000 to be taken out of the general fund. Instead, it shows up on urban development this month. And I don't think buying a building and tear it down qualifies as urban renewal, but nonetheless.
Sure it does. You're gonna build something on it, do it.
I recall asking that that be taken out of the general fund, and it was taken out of urban renewal, which is a separate issue altogether, I understand that. But I'd like an explanation of why we have to say that the reimbursement would be up to $3 million when we've got a $2 million commitment from the developer, up to $2 million. Does this mean we're gonna spend up to $5 million?
No, we just had to put a reasonable number on there on what we think the bonds may or may not get. It's, you know, just an approximation.
So if these bonds were to be considered, is this subject to council approval for these bonds?
Oh, yeah.
I think we're
This
kind of
does not,
rushing
this
this
does
here.
not, we are not saying we're gonna take out $3 million worth of bonds, right? You know,
First of all, you'd have to design, if you're gonna put a building, you gotta design the building, get a cost for the building, you know how much bonds you even need.
Right.
So that's where that comes in. All you're doing on this deal is recouping your money.
Spreading it over 20 or 30 years.
Yeah,
away
you're
from
gonna
bond.
get it out of the tip.
And that would be a total of how much? 38 for the, what was the demolition? 38.
It's 38,000.
So 103. 103,000 we'd be able to amortize into the bond issue.
Right.
Understood. But there's no authorization here implied.
No, you're not. We're still up to steps.
Okay. We'll readdress the urban renewal fund issue later.
No, whenever you'll know when you get the bond resolutions, as I'm sure some other council members can tell you, it's thick.
Understood.
It's gonna be 100 pages worth of documents.
Does anyone else have any comments? Or do you have any more comments? Yeah. Roll call vote, please.
Member Lynn?
Aye.
Member Bolter?
Aye.
Member Burns?
Aye.
Member Neary?
Aye.
Member Baker?
So ordered. Okay. That's all I got for now, but I'm gonna jump in front of Michael and call my department head so they can get out of here. Chief Butcher?
Good evening, Mayor and Council.
Good evening.
I have nothing to add to my report tonight. I just submitted it this morning, so I don't want me to read it all to you.
We're good.
Okay, that's what I thought.
Anybody got any questions?
Is there any questions on my report?
I just want to make a comment, Chief, and I told Dave before the meeting, I thought your staff, or your crew, your guys, your girls and guys, did a fantastic job on Monday night. They was very professional, both the police department and the fire department. If someone's not aware, we had a train accident up there, it hit a car, and so we're adjacent to my house, and did a super job. They got the man out, they was able to take him to the hospital. I don't know what happened after that, but very, very professional. And I've said this before, and I'll say it again. The police department and fire department, to me, are unsung heroes. They do a job that nobody gives them credit for. I just want to personally thank you and Dave for your job.
Thank you.
I have 2 questions, sir. Fireboat incidents. You list 8, 4 last month, 2, 1, and 1. And we talked before about insurance reimbursements on ODs, et cetera.
Yeah.
Is it, when we tow a boat in or have a boat accident out there, is that purely a cost to us, or how, are we reimbursed?
It's pretty much a cost to us, yeah. There's no one, even Boone County Water Rescue, Cincinnati, we talk about in our meetings, and no one's wanting to do it. It's just such a low volume run. We do not tow anywhere out of our area. Like we used to tow up to Schmidtfield or all the way up past Coney. We take them in Manhattan Harbor if they're a resident and they're from this area. Other than that, Boone County Water Rescue comes and tows them. We'll stay with them until Boone County gets there, and then we go back in service. That's one thing we did get away from.
Okay. I was just curious about that.
Yeah.
Someone else asked me the same question. So
You know, I thought about that anyway to generate money. I think it's a great
Give them a
conversation.
boot.
But I didn't want to be the only one of us, Covington, Silver Grove, Cincinnati, Coast Guard, all the only ones starting to charge. You know what I mean? It's just, if we're all going to do it, we're going to do it the way we talk. If not, then we're not going to do it. It's kind of how we want to go with that.
Understood. And I noticed on the EMS monthly squad report that year to date we have 149 falls. And I know that's a big issue. What percentage, and you can ballpark this, what percentage of those falls would you say are with the elderly?
A lot. Probably majority of them are.
I would like to set up an appointment with you and a representative of the Northern Kentucky Area Development District on the Senior Fall Prevention Program. Then I'll have some literature, et cetera, so that if you run into one of these situations, it's things to look out for and help that you can get. And that may reduce some of our calls and some of the injuries.
I know we do need, we used to get on first court all the time with manpower with the merger. You know, 5 people trying to cover 2 cities. And as busy as the Medicaid is, there's just not enough time with inspections and everything. But when Chief was there, we used to go down on Saturdays once a month, discuss and talk to the people in the bingo hall area. I remember taking medicines, safety issues on kitchens, not to put stuff on the stove, just reminders. You know, it's something we were looking to maybe get back into.
Okay, I'll set you up with that contact.
Okay, that's fine.
Thank you, Chief.
Anything else? Thank you.
Chief Hatfield.
I didn't have anything. Just the numbers that I gave out for the month, I don't think were very accurate. Just the end of the month came pretty quickly, and Cassie didn't have time to do everything in the day, so they're a little bit lower than it looks. And just congratulations to Sergeant Marksberry, who graduated through the Academy of Police Division. So he's the second one this summer to go. So everybody's been to the Sergeant's Academy. Hopefully we'll get him into the executive development in the years to come. I know it's down to 4 weeks, not 5 weeks. So it was a little bit hard when they go away for 3 weeks, especially when they're second shift and third shift. So that's why you see me out on second shift a couple of days, and it's, had to cover. But I think everything else is.
Keep up your work. Thank you. Bob?
Sure.
this month, we had our first CCAP, structural facade improvement program in about a year and a half, since Case, I think, was the last one. So that's for 526 6th Avenue. They're putting in the windows. I want to give you a heads up. When we expanded the program to the commercial buildings along 6th Avenue, I expect more of these to be coming in this year than we've had in the past year or so. So this is just a taste of things to come. So we're getting people investing in the buildings, and that's what I want to see. Invest in the buildings, then we move forward. They're also working on the inside of the building, cleaning it all up to put some type of retail or professional office in there, and there has been good interest. I don't have any announcements to make yet. But you want to talk about, we did have a loss this month. NKY Designs, it was upholstery left. It wasn't because the business was bad. It's the husband got transferred to Florida with his company, and Able Upholstery was the father, and they all moved down to Florida. So I've already been talking to the property owner about prepping those buildings for some new tenants. So we're moving forward on that. Other things to note, Dayton Bar and Grill and Christopher Phelps have both sold. You may know they closed down. A local business owner, an entrepreneur, has bought them. Their plans are to immediately work on fixing and upgrading the apartments, and then going down, and though both buildings have been inspected, there's some work that needs to be done, and probably sometime in the spring, they'll be running them out to new restaurant-type clients. So we'll have, probably next spring, we'll have some new restaurants there. It could be any time, honestly, but generally restaurants don't open after Halloween. I'm getting close to that, because sure, you have Christmas, then you have January and February where nobody eats out except on one day on Valentine's Day. So generally restaurants open in the springtime. Some events we have going on. Our final food truck Thursday is this Thursday. Empanadas are key, and Alejandro's coffee. We're gonna also have coffee there. This little thing we've done has really more than met my expectations. We've showed that there is a lunch market in Dayton. I think some of the interest we have in Dayton Bar and Grill and Christopher Phelps is because the person who purchased went down and saw that that's an opportunity there. And one side thing I was talking to Michael about is every month I've had something this summer to go down to the industrial park, hand out the little flyer, and get a chance to talk to all the businesses. And it's been good. And they even said, it's really nice because we know we have a face we know at the city. But I told them, I won't be in next month because they don't have a flyer to hand out to you. They all have our cards. They all know how to reach us, out to us. And I really think that has worked really well. EMS transitions over there. I'm really excited about the Jollies buying the old Hasco, and they've painted it. They're already talking to 2 tenants, potentially to move in there. No leases are signed yet. I have another tenant. There was at the welding supply company. They had, because the EMS has moved, they have 5,000 square feet open. We already had people going in there looking at that space. So, one of the unintended benefits that I never thought about when I started this would be the chance that it really gives us a chance to find a reason to go into the industrial businesses and talk to them for a minute, and not just being high on the city. I'm here to help, and they're scared. That terrifies me. If I have the food truck Thursday, then they know, I haven't done anything wrong. He's not going to yell at me something. Next thing I want to talk about, we got the 2 nano grants. We've got 2 events coming up in October. The front porch concert over on Vine Street. So we're going to do a block party with a lodge. That's moving forward for October 14th from 5 to 9 p.m. on the 500 block of Vine. And the high school band concert is going to be October 21st. At first I did say it might be last weekend, and then quickly I learned that the band concert, the high school band has changed their schedules. So, but we're set for October 21st. That's going to be a nice 2 p.m., a nice little event on the park. Get the high high school band there. They were able to use the funds to purchase their music licenses for the year, so that saves them money. And so that's going to be another good event. Some grants update. We've already voted on it, but I wanted to talk about, we did get the MOA for design of the state. Thank you, Jeff. You know I've been working on this for at least 6-7 months. We finally got it through. So I'm looking forward to seeing that project move forward. Recreational Trails Grant. I heard this weekend that that Fort Thomas had heard they got an RTP award, so I reached out to the state this morning. I know of at least 8 or 9 RTP grants were submitted, and only one got it from the Northern Kentucky Area Development District. We have it done. It's a good grant. It's a solid grant. There was just a lot of activity and interest in it this year. So it opens up towards November and we'll apply again. It's a marathon, not a sprint. Transportation Alternative Programs grant. That's open right now. It closes October 2nd. One of the things we looked at was upgrading our bus stops and street furniture. We put applying for a grant where I went and surveyed all the bus stops and tried to figure out which ones would have, the package could include up to a bench, a trash can, or a bike rack. Some have 3, some, depending on space, only have 1. If the sidewalk is 5 feet or less, and there's not room for a bench, unfortunately we're not going to be able to put one there. In Central Business District, as we move forward with the streetscape, we'll have bump outs for benches, so we'll be able to put them there. But there are some bus stops along 5th Avenue that have very narrow sidewalks, and you couldn't put anything there if you wanted. I just wanted to let you know. Also in there is, I've got permission from the state to put sharrows along Kentucky 8. Sharrows are markings on the road to kind of share the road for bicycles. So we'll be putting that in there. And earlier this year, we got some numbers from Duke about streetlights on Vine, Walnut, and Urban Terrace. Yeah, Urban Terrace. And that would fit also, so we're putting that in. The whole sum of everything is about $140,000. It's 80-20. So if we get it, it's going to be competitive. It would be $28,000, and that's far less than we ever even thought of applying for when we were looking into lights earlier this year. So if we get it, it's a good thing for us. Another last little grant I'm working on, the County Extension Service has an environmental stewardship grant. And looking at the plans for Vine Street Park, we've got the playground equipment in there, but no landscaping. So idea of putting a couple maple trees in there for some shade, a couple cherry trees, and some shrubs for landscaping around the little corner patio area. And in the corner, a butterfly garden. So it's a big thing for environment. I put a lot of things that flowered in there because that helps pollinators and butterflies, and it's environmental stability. So we'll be applying for that. So one last thing on trees, we remind everybody that we have a tree program. The deadline for an application is October 1st. If you're interested in having a tree put in your curb lawn or your yard, go to DaytonKY.com/trees for the application. There's a